Senior Focus. I'm Nick Coltis, your host. I'm here with Lauri from St. Francis Nursing and Rehabilitation Center and Donna Ostiguy.
Hi, Nick.
Hi, Nick.
Hello, ladies. How are you?
Very good. How are you?
It's a hot day out there, isn't it?
Yes, yeah.
Yeah, I didn't think it was going to be this hot.
I see people walking around with their umbrellas in case of the rain that we're getting.
It's a day to make sure you keep yourself hydrated.
Yep, yeah, true.
A
Yeah.
lot of people don't do it and they run into some problems.
Yep, especially the elderly.
Yeah, the elderly.
Yeah.
It's very important that on a day like today they have adequate hydration.
Yeah.
They drink enough water.
Right, and somebody has to almost force them to do it.
Yeah.
Put it in front of them, say, take a few sips.
So you're with St. Francis?
I am. I am their clinical nurse liaison at St. Francis.
Yeah. What do you do there?
What my position is, I do referrals, so we get patients into the facility. So I've been doing the job at St. Francis for about 5 years now, but
Yeah.
all in all, I've been doing this job for 15 years.
Uh-huh.
So I've been in Worcester, getting all the elderly into facilities.
You've
and
been doing
getting
it
them
for a
the
long
help they
time. You're old
need.
hat
Yeah,
at this.
Yeah, a long time.
Yeah, yeah.
Yep,
So
love it.
what do you do?
Basically,
Do you go to the
I
hospitals?
do. I hit
and-
all the hospitals in Worcester. I hit the three major ones. I hit UMass,
Yeah.
Memorial, and St. Vincent's.
Okay.
How it works is a case manager will call me and say that she has a referral from St. Francis. The referral could come from family requesting to go there,
Right.
or a physician saying that he wants his patient there.
Yeah.
And then I go to the hospital. I gather all the information, whether I get it from the chart or the computer nowadays. That has changed.
Okay.
Everything's computerized at these
Yeah.
hospitals.
Yeah.
And then I evaluate to see if the patient's appropriate to come to St. Francis.
Do you have to go there to gain access to the computer?
I do.
or-
That's the
yeah,
only
you-
bad thing. Eventually, maybe with the computers, we'll be able to get off-site access.
Yep.
But right now, in order to get into their systems,
Mm-hmm.
I do have to physically be in that hospital. Then I can put in my codes and get into their systems.
And when you're there, do you actually go and meet the person and talk to the person?
Yeah, I'm actually like a regular hospital staff when I'm there.
Yeah,
Everybody
yeah,
knows you.
yeah.
I go to the floors, I go to the charts, I get what I can out of the charts, I go to the patient's rooms, I meet the patient, I'll talk to the patient's nurse, I'll call the families, even talk to the physicians while
How
I'm
do you
there.
know if someone is an appropriate fit for St. Francis?
Basically, we really do love to have the patients at St. Francis, so we really deny very few.
Okay.
But it's just a matter of me seeing what floor I feel they would benefit on.
Yeah.
Sometimes I get a referral and it could be a short-term rehab. So that patient would go to my short-term unit.
Okay.
You know, because I know they're only going to be there probably less than 30 days or so. But sometimes I'll get a referral where it's going to be long-term. So then I have to make sure I have beds available on my long-term unit that would be a good fit for them.
Is there any other difference beside the length of time that someone is expected to be with you that determines short-term care or long-term
Yeah,
care?
definitely, because the short-term patients are usually more intense.
Okay.
They need their IV therapies. Some of them have new surgeries, so there's wound care involved on some of them. Other ones just what we would call like a buff and puff. They need their physical therapy, their occupational therapy, speech therapies, just to get them back to their baseline to go home.
Right.
Usually the long-term patients are more custodial care. They can get their rehab and everything up on our long-term units, but it's more for patients that we know it's going to be their home. So we would rather put them straight to their home versus putting them on the short-term unit than having to move them up, because sometimes that could cause confusion in the elderly.
Right. But I think what you're saying is you can get the same services in the long-term care unit as you
Yes.
can in the
You
short-term care
can,
unit.
definitely. We can do both services, all the services in both units. But if we do know that you are short-term, we do put you downstairs into the short-term unit.
Yeah, I agree. It would be very, very difficult for someone, particularly with some kind of a cognitive impairment or memory
yeah.
disorder. They go into long-term or into the short-term care section, and then from there have to go to long-term care. Yeah, it would
Sometimes
create
we
a
don't
lot
know.
of
You know, we
angst.
do think they are short-term, and then
Yeah.
something happens and they do
Right.
become long-term, and we will move them up. We would never take a patient, if we take a patient short-term and they need to stay long-term, we would never send them to another facility. We keep them at St. Francis. So that would help with their confusion too. They know the staff, they know everybody. It's just a matter of moving them up to a different unit.
What are the different kinds of care that you can provide? Can you provide anything that someone needs, or is there
We
certain
pretty
things
much
that...
cover the whole gamut of medical care.
Okay.
We can do tracheotomies, we can do the IVs, we can do the wounds, we can do the physical therapies. We have a sensory integration program that we do. We can also do their spiritual needs.
You know,
we can
let's
do
talk about the sensory, what did you call it?
sensory integration.
What is that?
Our PT department is running it. Dana is our director of PT, and
Yeah.
it's a system that she's known for years, and she's perfected it. She's right now doing it mostly with our Alzheimer's patients.
Right.
What it does is, if we get an Alzheimer's patient in that has a lot of behavioral issues, this sensory integration is basically like touching a patient in a certain way, maybe rubbing their hand, it may be giving them a back rub, getting them into a quiet area to calm them down. We have seen behaviors decrease by 60%. So that means less medications for the patients, easier to manage on the floor, happier patients, happy family, happy staff. So she's had some great results with the dementia patients.
You know, the fact that the medication they take is decreased really is
huge.
a huge thing.
It's huge.
When I went to my doctor, and I used to take high blood pressure medicine, but I don't anymore, and he was so happy that I didn't have to take high blood pressure medicine anymore, and he said, oh, thank God, you don't have to put that stuff in your body anymore.
Yeah, and I agree with them, because you don't know what the medications are doing to us. And the less you take, the better. I mean, unless it's a med that you truly need, you need to continue to take that.
Right.
But especially with behaviors, if you could keep them more alert, more in tune with what's going on, it's better for them.
Well, it seems as though people with a cognitive impairment would seem to be, you know, over-medicated in many facilities. It's kind of like they're restrained, but they're chemically restrained,
It is
what it
considered a
seems
chemical
like.
restraint.
Yeah.
It really is, even though, you know, we're not allowed to do any restraints at St. Francis.
Right.
We're not allowed to do any physical restraints or chemical restraints.
Right.
But it does alter their patient's perception and what's going on. So the less, the better. You know, if you had to use something in a crisis situation, then you use it so that the
Right.
patient doesn't hurt others and themselves.
Right.
That's the main issue, patient safety. But all in all, the sensory integration is working well. She's, you know, she's designating some patients right now to work with, and then from there, you know, she'll expand how many that need it in that unit. We have
Well,
2 Alzheimer's units.
It's a wonderful program.
It is. And
that-
it's fairly new. I'm not sure if even every other facility is using that yet.
Yeah, maybe not. Any program that seeks to reduce the amount of medication that has to be given to people
Yeah.
that, you know, suffer from a cognitive impairment is a really good thing.
Yeah, I agree. And
Now-
families would agree too.
Oh, yeah. I'm
Laurie,
sure
as
they
far
would.
as if someone was to pre-plan a surgery, and many people choose elective surgeries at this
Yes,
point for
yeah,
hip
yeah.
replacement,
Yeah.
for shoulder replacement, knee replacement, you obviously, I'm assuming you do, allow a patient to call, or an upcoming patient to call and say, I'd like to tour the facility, I'd like to find out what the rehab is like, what you offer. Can you set something like that up?
100%. And I would encourage anybody to go do that, whether it's St. Francis or another facility, because it gives you the ease of knowing what you're going into post-op or for your rehab. So basically, the easiest way to do this is they could either call me directly. Again, it's Lauri Dorico. I'll even give my cell phone, which would be 508-340-2195. I have my phone on me 24/7, and believe me, I do get calls all hours. But feel free to call me. I'll invite you in for a tour. We'll show you the facility. We'll show you our speech therapist, our therapy room, which is brand new.
Yeah.
Show you the physicians. You just get a feel for the place, because you have to know where you're going, and you have to be happy with where you're going. So any kind of pre-op, you certainly could do that. That gives you the advantage that when you do go have your surgery, you know ahead of time where you want to go. So when you get to that hospital and the case manager says to you, you know, the doctor suggests you need some rehab, you can automatically say, yes, I've been to St. Francis, I loved it there, I would love to go there, and
And
they
a lot
know
of-
to call me.
A lot of people use it too for ease of convenience if they have that loved one who's very close. And I've heard this time and
Yeah.
time again, even with clients who say, I'd like them in a facility that I have easy access to.
Yes.
The wife who's at
Yeah.
home, the husband who's at home who has to travel
Yeah.
to go and see them daily. And that's the point of it. You want ease of access.
Yeah.
You want great care.
Yeah. There's a
Especially
lot
with your
nowadays,
new,
yeah.
your new rehab. We were fortunate to be part of that
Yeah.
when it was the big...
And there is a lot of competition out there
It
now.
is,
You know, we
yeah.
have a lot of facilities in Worcester, a lot of skilled facilities. So you do, location is a big thing, you know, especially if it's an elderly person. They can't drive, you know, someone has to drive them every day to the facility to visit. We are on a bus line, so if somebody needed to take the public transportation, they certainly could. So there are a lot of things to think of before choosing your rehab, but a tour is a phenomenal thing because that way you know where you're going, you've been there, you've seen it, you know, and you could always use me as a resource, call me anytime and ask me questions. I think that's probably the main part of my job that I enjoy the best, is that I am, in a way, a teacher. I get a million questions. I educate the public on what they need to do. Even if they don't come to St. Francis, I sometimes get phone calls saying, you know, hey, what do I do? Because there's a lot of questions, and it's a lot of people are nervous, and they want to make sure they're putting their loved one in a good place, whether it's for short-term rehab, long-term care.
And
you know,
their
the whole
mind be at
gamut.
ease that even though they're going to
Yeah.
go for surgery, which potentially makes them nervous inside, they've got it all covered. We talk all the time, Nick, about people being educated, be proactive, choose,
Exactly.
and that's the point. The knowledge is power. That's Nick's
Yeah,
big
I
mantra.
totally agree
But,
with you. Yeah.
The facts are is that if people are more educated, they can make informed decisions on where they want to rehab, and they may find that it's a fabulous place and
Yeah.
say, geez, you know, my husband
Yeah.
or I have to have my other shoulder done, my other knee done.
Yeah.
I would definitely go back there again, and that's the beauty of really being educated and choosing, and they get to
I
choose.
totally agree, because you get to the hospital, you're overwhelmed, you may be in pain post-op, and now they're throwing it at you. You need to go somewhere. You have no clue because you haven't visited anywhere. So at least if you do prepare ahead of time, get knowledgeable on what's out there, it will make you and your family more at ease.
My mom was hospitalized,
Yeah.
and they didn't give her an option. And
Sometimes they don't.
They don't, and I
So you need to
understand there's a
empower
need to fill the bed.
yourself, yeah.
But the point is that if you can choose that option to choose
Exactly.
where you want to go, where you're most comfortable, where you may have heard from a referral that,
Yes,
wow,
yeah,
they offer
yeah.
fantastic rehab, fantastic care, that's so important. And
It's
there's
all
other
about
factors that go in.
pre-planning.
It is, and I could even visit you in the hospital and just, you know, and that kind of eases you too. It's
Ease
a
it.
friendly face. You say, oh, hi, saw you, you know. So you do have to be your own advocate, I guess, too, because if you get into the hospital and they say you have to go here, there, and that's not true. You know, you do have a choice.
You know, people will think that the preparation that they need to do before they go in for a procedure in the hospital involves directly the care that they receive in the hospital. But as we were just saying, the truth of the matter is, eventually, you know, you get discharged from the hospital and you may not go straight home. You may need to spend at least a short period
Yeah,
of time
yep.
in a rehabilitation center. So the preparation really involves far more than just looking at, you know, the particular hospital or the procedure,
I agree.
but where you're going to go afterwards.
Yeah.
And like I said, if you look beforehand and you know what your options are, you can make an informed decision
Exactly.
where you're going to go.
Yep.
Let's talk a little bit about the location. We said how important
Yep.
it was.
We're right in the hottest city of the Worcester. We're at 101 Plantation Street in Worcester. I think it's the oldest nursing home in the city of Worcester, so
Yeah.
it has a great reputation. It used to be called St. Francis Home, but it's now St. Francis Rehabilitation and Nursing Center. We've had a lot of improvements lately. We've put in millions of dollars into the facility, like you've just
And it
at the new
shows.
gym.
Yep. Yep.
The main thing I could say about St. Francis and the location is that it has a lot of heart. You know, being in the city, and a lot of our employees have been there a long time, I would feel very confident in putting my loved ones in there just because of the care and the nurses' care. You
What's-
can get
what's the
nursing care
landmark? Like,
anyway.
For those who don't know, when we say it's in the city,
Oh, yes,
Worcester's
yeah.
a big city.
It's close to UMass. It's
Okay.
close to Memorial, so it's in a great location for that. So if families know how to get to UMass, I can tell them it's easy to get to St.
Hamilton
Francis.
Street, simple to get to,
Yep.
simple.
It's right on Plantation Street, so if you can go up Belmont, you're gonna take a right onto Plantation, follow it past Dino's Pizza, which most people know Dino's Pizza.
It's a
The
great
old
place.
Plantation Club, we have an undercar garage, we
Yeah.
have street parking. You know, that's not, we have 4 floors. So it's pretty centrally, like again, I said, it's on the bus route if
Yep.
people need it. Or you could go straight up by St. Stephen's Church, go straight up the hill, up Plantation, up Hamilton, take a left on Plantation, and
And
it's
you're
right
right
there.
there.
There is a gazebo outside too, so you might be able to see that and know that's St. Francis.
Well, Laurie, I want to thank you for joining us
Thank you
today.
so much. Yeah, it's
It was
been
wonderful
fun.
having you here,
Yeah,
right?
thank you very
It's
much.
such an important thing,
It
people,
is.
to, you know, we talk about pre-planning and estate planning and durable
Yeah,
powers
yeah.
of attorney and healthcare proxies and surrogate decision-making documents.
Yeah.
Yeah, that's all very important too. But if you know that a particular procedure is going to take place and you need to, go to the hospital and have that done, it's not necessarily going to be over the moment you leave the hospital. Could be that from the hospital you go to another facility. Makes sense
Yeah.
for a person to do their due diligence, find out where they're going to go. So if they have questions, number they
Call
can call
me.
you at again?
Yep, 508-340-2195. That is my cell, and truthfully, it never leaves my hand. So I have it
Lauri,
on me all
thank
times.
you for joining us
Thank you
today.
very
Thank
much,
you,
Nick.
Lauri.
And thanks,
We're going to
Donna.
head
Thank
to a
you very
break right
much.
now. When we come back, more Senior Focus. I'm going to talk to Donna about ways that we discipline our children today.
Join us on Tuesday, September 16th for a free symposium, Living Well to 100. Open to the public, free admission, free buffet lunch, free raffle prizes, and free community resources. Call us to register at 508-459-5057 or visit us at www.theseniorfocus.com.